Hi, my name is Drew. I'm a nurse practitioner here at the PrEP Clinic. What brings you in to see us today?
Well, I have a partner that's HIV positive, and his clinician has suggested that I come in and talk to someone about PrEP because my partner is positive and I'm negative, and we want to shy away from using barriers when we're intimate.
Okay. Do you know if your partner, have you went to medical visits with your partner? Do you know if he's what's called undetectable?
Yes, we just, this last appointment was discussing that he is undetectable, and we were talking more about coming away from the idea of using condoms because we want to be intimate without a barrier. And my doctor's clinician recommended that I come talk to someone about PrEP for me.
Yeah, so I can give you more information about PrEP. PrEP is something, it's a pill that people take every day that prevents HIV infection. So studies have shown that if someone takes it every day, then the risk of HIV infection from a partner is very minimal. So your partner being undetectable is great because that means that your risk of acquiring HIV from him is pretty minimal anyway. But PrEP would give you kind of an extra layer of protection. Also, are you guys mutually monogamous? Do you have other sexual partners?
We both have other partners.
Okay. And do you always use condoms with them?
Most of the time.
Most of the time? Okay. So I'd always recommend that, you continue using condoms or barriers with your other partners, but it sounds like you may not know those other partners' HIV status, and so it sounds like PrEP may be a good idea for you to give you that little extra protection with your partner, but also in your sexual encounters with other people.
Okay.
What do you do for contraception? Were you considering having children?
No, we discussed not having children right now.
Okay. Well, just so that you know, couples where one person's HIV positive can have healthy HIV negative children. So that would be just your partner being undetectable is great, and then you being on PrEP, giving you that extra protection, could totally facilitate you having a baby if that's something that you guys decide to do in the future. In the meantime, there's lots of other options for things that we can do for contraception to help you from conceiving. So there's like an IUD. Women like IUDs because it's a device that's inserted in a clinic, and you don't have to take a pill every day. It's very easy. They last for 3 to 10 years, depending on what type they are, and then they can be removed at any time, and you can get pregnant if you decide to at that time.
Are there any risk of getting pregnant after having an IUD?
There shouldn't be. So we know that people, when we take the IUD away, you should be able to get pregnant immediately after that. Why don't I give you a referral to someone in women's health, and they can kind of go over all the options with you, because there's lots of different options. Even in the IUD, there's several different ones. They can talk to you about the efficacy, the risks and benefits of each one with you.
Okay, yeah.
Okay, perfect. I will put that in.
Thank you.
Did you have any other questions about PrEP?
Yeah, one question about PrEP I had was, even though it gives me an extra barrier, how minimum is the risk?
So in studies where we looked at people who took PrEP every day, the risk was almost none. So it was 99% effective. Studies can never say something's 100% effective, but in the people, in that subsect of people that took the pill every day, none of them acquired HIV. So the risk is very, very low. And again, you have that extra layer of protection with your partner being undetectable. So also in partner studies, where one partner was HIV positive and one partner was HIV negative, we know that as long as the partner who was positive was undetectable, that HIV wasn't transmitted between the partners.
So Is PrEP covered by any insurances?
PrEP is covered by most insurances. And also, we've got different ways of helping people get access to it. So depending on what type of insurance you have, there may be co-pays. We can help set you up with co-pay cards, or we can try to access different avenues to help you get it at minimal cost.
Does PrEP work right away, or does it have to build up in the system like some drugs do, and before I'm able to not use barriers with my partner?
That's a great question. So it depends on how you're having sex with your partners. So the recommendation is that you be taking it for a week if you're having anal sex with your partners or you're having an anal exposure to HIV. And the recommendation is 20 days for vaginal exposure. So that means we usually recommend for women who are having vaginal sex with their partners that they take it for approximately a month before we remove the barriers, condoms and things like that.
Are there any known side effects of PrEP with health, blood pressure or anything like that?
Yeah, with disease, there isn't. We do monitor kidney function. So something with PrEP is, in a very small subsect of people that take PrEP, there's an adverse reaction with their kidneys. So we want to, before we start PrEP on you, make sure that your kidney function is good, and then we would want to monitor that occasionally to make sure that it's not decreasing. If we were to follow up with you in a couple months and your kidney function reduced, we'd be able to take PrEP away or Truvada away, and we would, in most cases, we'll get the kidney function right back. But it is something that we pay attention to. As far as side effects, we don't have a lot of reported side effects. We do have a little bit. Sometimes people report nausea or slight abdominal pain. Usually if people take it with food, we're able to kind of negate those.
Okay.